Hi, this is Sury with 573 Medicine. Today I'm going to be talking about kidney anatomy. So first, some basics. The kidneys are retroperitoneal organs, so they are located posterior to the abdominal peritoneum. They are also below the diaphragm, which is right here, and they are also located posterior to the liver, which would be right on top, right about here. They are bilateral organs, so there is one on each side, and they are described as bean-shaped and about the size of a fist. They span roughly between the T12 to L3 vertebrae, and it's important to note that the right kidney is usually a bit lower since the liver sits right above it. Next, moving on to some surrounding anatomy, there are two important layers of fat around the kidneys to cushion it, the peri and pararenal fat. Peri means surrounding, while para means beside or near. Therefore, the perirenal fat is going to be the layer just around the kidney, while the para is going to be a little bit more adjacent. So here's an overlay to see that more clearly. So we have the perirenal fat in purple and the pararenal fat in blue. And then here's another diagram as well. Notice in both of these, there are a few other layers. So going from the kidney, going out, these are in order: the fibrous capsule of the kidney, then that perirenal fat, then the renal fascia, and then the pararenal fat. So the fat is going to alternate. Next, we're going to talk about the hilum and the suprarenal glands. So the renal hilum is an indentation of the kidney, and it serves as an entry and exit point for the ureter, renal arteries, renal veins, lymphatics, and nerves. The suprarenal glands, also known as the adrenal glands or endocrine organs, and that are going to sit on top of each kidney. People like to refer to them as kind of the kidney's hats. And then finally, we have the ureter, which is going to transport that filtered fluid or urine from each of the kidneys down to the bladder. Next, we're going to go over some of the more detailed internal kidney anatomy. So this outer layer is the cortex. My mnemonic for this is the cortex is the cover. And then the next more internal layer is the medulla or the medullary pyramids. So they're in this sort of triangular shape, which makes sense with pyramids. And my mnemonic for this is medulla is the middle. Next, we have the papilla, which are these anatomical protrusions or nipples. And so this is a word that comes up a lot in anatomy. And so the renal papilla are these protrusions or nipples of the medullary pyramids. And then last, we have the renal columns, which are an extension of the cortex in a very columnar shape, and they are going to separate the medullary pyramids. And then also notice that the cortex and medulla, although you can't see here, this is where those nephrons or the individual filtering units of the kidneys are going to be located, but that will be for another video. And then last, I'm going to go through the flow of the urine as it exits the kidneys. So like I mentioned on the previous slide, all that processing is going to take place in the cortex and medulla, which is going to form urine. And this is going to pass through the medullary pyramids into the papilla, which are those tips. And this is going to pass from the papilla into the minor calyces, which are these openings down here. And the minor calyces are going to come together and drain into a major calyce. And then the major calyces are going to come together and drain into the widened renal pelvis, and then out through the hilum into the ureters. And then finally, we have the renal sinus. So this is really more of an area rather than one single part. So it is a fatty compartment, and it contains the hilum as well as the major and minor calyces we mentioned. So overall, it's this whole area shaded in blue, minus that renal cortex and medulla. And that is all. Thanks for watching.